Hello, everybody, and welcome to Wednesday Wine with Ana Belaval, live from Chicago, Illinois. I'm glad that you are all here with me again, and let me know where you're joining me from. I am in the heart of the Midwest. We are in the middle of phase 4 of this pandemic, but we are still being cautiously optimistic, but still cautious. And we are still homebound. So I hope you are all taking all your safety precautions, using your masks the right way. And of course, I join you on Wednesday on Hump Day because, as I've said before, it is the hardest day for me to handle because I feel like I'm not even halfway there. I'm almost right after Monday, Tuesday, and Friday seems so far away. So I'd like to join all my friends on Facebook with a little wine. And if you don't have Facebook and you are joining us on my YouTube channel, then let me know where you are watching from. And if you're enjoying your time with me, ahora vamos. Una, dos y tres, salud. Lo necesitábamos. And I don't know if you heard the door closed, they are gone. And now I can have peace and quiet for a little bit. You're my excuse to be alone in the house, Wesley, porque no me dejan sola. I had 30 minutes alone in the house the other day, and so my son was at someone's house, and they called me to come pick him up that the play date was over. I almost cried. And my husband said, well, go to Starbucks. I'll stay home with him. You'll just relax outside at Starbucks. I said, it's not the same. I want to be home alone. Like my mother says, quiero correr desnuda por mi casa en panties y brasieres. Quiero oír música. Quiero ver Netflix without people trying to figure out what I'm doing or asking me for a spoon or yogurt or to watch some TikTok video for the 500th time. I just want to be alone. So you on my Wednesday wine, you are my excuse. But today I'm super, super excited. I book people on this Wine Wednesday or Wednesday wine. We're not sure what we're going to call it yet. That I don't get to talk to for Around Town on WGM Morning News, which you know is my gig every morning. And I'm back out on the street and I'm really loving it. But I don't get to do long interviews with fabulous people that can really help us out and shine some wonderful light in our lives. And today is no exception. Today, we have someone that has become a beacon of light for a community in Chicago and Illinois that had been greatly affected by COVID-19. I'm talking about los Latinos, nuestra comunidad, right? For many reasons. We were brown people, Black people in the state of Illinois were affected by COVID-19 more than any other communities, just like at nursing homes, because I know that when I posted about the Latino and the Black community being affected by COVID, a lot of people were like, oh my God, you're forgetting about nursing homes. It's been awful. I understand. And none of them were getting the right help. So in comes this firecracker of an allergist, Dr. Juanita Mora, which like a lot of other doctors decided that she was going to help her community out when she became a doctor. And she got more than what she bargained for now for COVID-19. Because remember, Dr. Mora is an allergist, not a general practitioner. She's not used to dealing with certain viruses, but she heard the calling in Spanish and she said, I'm going to be there and I'm going to help everyone. Thank you so much for joining us. Brenda, hello. I'm going to say hello to Brenda. Nancy, I'm going to say hi to Juanita in 1 second. Hi from Joliet, Virginia. But I want to get to my guest and then I'll say hello to all of you. Don't be bummed out. I love that all of you are joining us. Dr. Mora, hello.
Hola. Hi, everyone. Such a pleasure to be with everyone today.
Listen, I have to say something. When I announced you on Monday, you have the nicest patients and colleagues. They adore you.
Oh, thank you. I am blessed in many ways.
Yes, you are. And they were so excited to hear from you. And I think that when we can have a long conversation where people can ask questions directly from you and also find out why people like you and I freaked out when the numbers from the Latino and the Black community came out about COVID-19. It's not that we want to make it a racial issue. It's not that we are like, oh, they are more important. It's that no one was paying attention to the amount of people that needed care and were dying. Tell me the story. How did an allergist who, was prescribing EpiPens and who was doing allergy tests on the kids and checking out the asthma ended up being a beacon of light for the community, where you've been on Univision and Telemundo and CBS and US News and World Report, and you lived up to the challenge of being a community doctor?
Well, like I said, I've been very, very blessed. And this journey all started really, I've been working alongside the American Lung Association as volunteer national spokesperson, entering my third year now. And they have really allowed me to be a voice for those that have no voice. And I went on Univision in the middle of the pandemic. All of us are in our homes. Everything's closing down. Factories are seeing outbreaks in the Latino community. Grocery stores and Milagro starts having the deaths there as well too. We have the meat packing companies with outbreaks as well too. And I go on television and I'm talking about who's at risk, the moderate persistent to severe persistent asthmatics as far as COVID-19 and what we can do to help. And suddenly, all these phone calls started flooding my office, and they said, well, will you see me, Dr. Mora? There's an outbreak at my factory, and I don't know if I have the virus. I've been sleeping in my car. I don't want to hug my wife. I don't want to hug my kids. At that point, there's no testing except for first responders as well, too. So that's one of the things that we're actually facing. Mm-hmm. And then the other thing that we're actually doing as well, too, is we're facing where there's actual deaths, and they don't know if they actually were exposed to the virus themselves because they work with these people who were dying, and they didn't know if they had the virus themselves as well too. And then some people who had ended up in the hospital already with the virus and were wanting to know if their body had already fought the virus. So important questions that were coming up. And it was, and there was nowhere that people could go. Doctors' offices were closing. And, they told people, well, if you suspect that you have the virus, you know what, stay home. And if you get really sick, then you go to the ER. But if not.
I was told that. And I am fluent in English, and I don't work in a factory, but my doctor pretty much said we are not seeing anyone with respiratory issues.
Absolutely. So I actually at that point said, I talked to my staff. So Chicago Allergy Center, my sister's my business manager. My niece is my receptionist. Lily, my medical assistant, has worked with me before. It's our girls team. And I said, girls, our community needs us to help navigate this pandemic. So, and I said, I know the virus is scary. We're watching Governor Pritzker and Ngozi Ezike from the Illinois Department of Public Health religiously, 2:30 p.m. We were all watching. And it was like, what are we going to do to help? And I said, we have too many asthmatics, kids and adults. I don't want to send them to the ER, so I don't want to close my doors. So we're going to stay open and we're going to fight. And here's my proposition to you girls. I said, we're going to have faith over fear. And we are going to help navigate this pandemic. And we're going to listen to those patients who have had this cough. We're going to determine if those patients have been exposed. We're going to help them navigate back into the workplace. And that's kind of how it all started. And suddenly Were
you wearing like hazmat suits? Like, did you have the PPE for it?
So we were wearing masks. And, we were religiously doing hand sanitizer like there's no tomorrow. And thank God we've all been so safe completely. And I said, this is lungs. I've got this. I listen to lungs for kids and adults all the time. I can take care of these coughs. And that's kind of how it went. And suddenly one coworker would refer the other. Companies started contacting me as well. Dr. Mora, will you help us do contact tracing in the workplace as well too? Like who was exposed, who wasn't? And I've learned so much on that, like through this all. One of the things I learned is the CDC was giving guidelines saying, well, people who test positive keep going to the nasal swab every week. And then once you test negative for the nasal swab, you can go back regardless of being asymptomatic. But what we found out now looking back, and that's what I was seeing, is that the nasal swab detects dead virus and can last positive for weeks to months. These people needed to get back to work. And so that's where I started antibody testing as well, too. And then if they were asymptomatic, I listened to their lungs, made sure everything was good. I sent them back to work, wrote letters. And then I found situations, Anna, where they had not done social distancing. They had not done masks at work. They had not done any safety precautions whatsoever, because a lot of the workers were immigrants. So they did not have actual legal status in the United States. So they told them, well, if you want to continue working, you can continue working, but we don't have to put any safety measures in line for you.
I know my children have been blessed with a babysitter who is like my family, you know, and she quarantined, but her brothers went to work at a factory and got sick and got everyone sick in the building because they all live in the same building. And her 95-year-old mother got sick but survived it. Wow. And they all survived it. And she came back to work with us after taking a COVID-19, another test, and it came back negative because she also takes care of the elderly. And so she needed to do that. And there is a necessity in the community. I want a quick question on this. You said if you're asymptomatic, you would send them back to work. So if you're asymptomatic, no lo pegas, you're not contagious?
You're not contagious. So at that point, if they had done their 14 days of quarantine and they were asymptomatic, and they showed nice antibody levels response to their body showed, then they could go back to work.
But let's say if you test somebody that is asymptomatic la primera vez and you test them and they're like, I feel fine, but I was in contact with somebody and they test positive. Do you quarantine them?
I do quarantine them.
Okay.
Absolutely.
Why?
Absolutely.
Why?
Well, the reason to quarantine them, well, if they do test positive, because then they might be one of those asymptomatic carriers. So you still want to be careful with that same person. But it's not the same situation as someone who was, for example, at work and did have symptoms and then had the nasal swab that was positive and then continues to be positive, but the symptoms resolve.
Okay. All right. Greg is asking, I was in Midlothian store Sunday. They said wearing a mask is optional in their store. I immediately left. Is wearing a mask optional in Illinois?
It should not be. It should be mandatory because remember, it protects.
But is it? Is there a mandate?
No, there's no mandate.
They're okay. Okay. But you think it should be? It
should be. Absolutely.
Yeah.
Absolutely.
Here's my other thing, Dr. Mora. Now that I'm back on the street, which I love being back around town. Yesterday, I went to Little Village to a beautiful mission they're doing there at the corner of 27th and Lawndale. I arrive and the pastor from New Life Center says, this is the most affected area in Illinois. And my team and I went like, uh-oh. But I can't help feeling very comfortable with my mask on if other people are masked. And I got a little too close. I got too close to my producer and someone called me out on it. She was masked too. Does the mask take care of the social distancing or do I have to do both?
Do both. Absolutely.
Ay, ya me regañaron.
No. I mean, we're not going to give you the most efficacy, but we want to still continue the social distancing as well, too.
Okay. Now, we are all worried about COVID-19. Now that I'm back out and my son is going to camp, I am freaking out about strep. I am freaking out about all those colds that my asthmatic kid catches. And when do I go to somebody like you? Like, can I go to I don't want to be a burden to the system.
No, absolutely. So now a lot of doctors' offices are reopening. So we definitely want to go if there's any suspected strep, any respiratory virus, because remember, as we enter the summer, we're going to have the summer viruses. And then the fall, we're going to have flu coexisting with COVID-19 this year. So and people can get both at the same time. So this is where my big recommendation as we go into the fall is that people get their flu shot early. Because we want to build that immunity fast. Absolutely.
Okay. I'm going to write that down. Get your flu shot early. And I'm going to put it right there so that people can see it. Because again, you could end up with COVID and flu at the same time.
At the same time. So that's where people don't realize, and we don't want to overwhelm the healthcare system, as those two can coexist. Absolutely.
Okay, my other what would be the top 5 things to know at this point about COVID-19 and how to protect ourselves?
So one, mask, just like you said, Anna. They're going to be protective to you, and they're going to be protective to others. Frequent hand washing and use of hand sanitizers. I can't stress it enough. I think it's what's kept my team, mask and the actual hand sanitizer, safe as well too. Social distancing practice. Avoid crowded places. If you go to a restaurant and it's crowded, step out. Absolutely. It's not that serious, right? If you are sick, do not send a kid to school sick. Do not go to work sick. Remember, we want to protect others as well too. And if you have any underlying respiratory disease, like for example, asthma, COPD or emphysema, chronic bronchitis, interstitial lung disease, take your medications. This is a respiratory virus. So we want to make sure that we have these diseases under good control. So we're going to be less likely to get the COVID-19 complications.
That's what my son's doctor and allergist told him right before this. They said, keep him on the inhaler and the Flonase in the morning, or I'm sorry, he takes Zyrtec in the morning, because we don't know this virus and we know that it's respiratory. So we don't know what it'll do to somebody like him, which scared me. How in danger are kids? Because I've heard pediatricians saying that the kids can't pass it on to each other. But then I hear that in Florida, there are cases of thousands of kids.
Sure. So kids overall, worldwide, children make 2% of cases globally of COVID-19. But this is a respiratory virus. So studies have shown that kids can transmit it to adults and kids can transmit it to other kids as well, too. So now that they're starting school and so forth, we need to be careful as well, too. That's why they're going to be required that the kids use masks as they go back into the school system. But as they're weighing everything else, they are seeing that they are only 2% of cases worldwide.
Okay, so they're not as affected, but they can be, and we don't want to push it.
Correct.
Daisy asks, what about those people who are allergic to the flu vaccine?
So they can go to an allergist, get tested, and actually take it, hopefully.
Oh, you believe in it, my friend. Okay, here's the other one. Tina, are pneumonia vaccines helpful at all with COVID-19?
So pneumonia vaccines are going to be helpful for those who are maybe prone to actually having pneumonia, or they're due for that as well too. So I check a lot of pneumonia titers in people who get frequent infections. So if it's a person with frequent sinus infections, frequent ear infections, frequent bronchitis as well too, it might be that their strep pneumo levels or titers, which is the bacteria most likely to cause ear infections, sinus infections, and bronchitis, might be low. So then they might have gotten a bad vaccine batch when they were kids. So then you give them this vaccination to kind of reboost their immune system a little bit. So that's when they might be helpful, more in the immunocompromised or those with recurrent infections.
My son got that pneumonia vaccine. His arm hurt for like awful. The second one, the booster. Me sentí mal right before COVID. And I was like, seriously, why did I do this? And I called the allergist like, what did I do, my baby? And they're like, chill out. It can happen. Pero I'm like,
absolutely protected.
Agree. All right. Trisha, we lost my mother-in-law 3 months ago to COVID. My mom, stepfather, father-in-law, and brother-in-law all tested positive and have antibodies. My mom is traveling in from Florida for medical treatment of an unrelated issue. Is there any concern for us having her stay in our home as we have tested negative for antibodies? Can they carry the virus to us even though they already have been ill?
So they can get it again. So people who have had the virus can get reinfected. So that's another thing that I want to clear up as well too. So because her mom is traveling to a high hotspot area, Florida.
No, she's coming from Florida.
She's coming from Florida.
She's traveling in from Florida for an unrelated issue. And she did they had all tested positive and have antibodies. They're coming in. She wants to know, does her mom have to find somewhere else to stay?
So they can do as much social distancing as possible in the house.
Okay.
But I would quarantine the mom. Absolutely.
Meaning lock her, like leave her in the bedroom, leave in like bedroom, bathroom. No, en serio, Juanita. I gotta ask you these things.
Absolutely.
Almost like bed rest, bathroom, and I'll leave you la charola outside the door.
Absolutely. Put the food outside the door and then Clorox wipe the little handles.
My God, you and Dr. Ezekiel are never going to let me come out of my house. Oh my God. Okay. When should we start getting the flu shot? I know early, but when is early? Someone who works in the school system, Esmeralda, is asking.
Oh, that would be great. So we're hoping to have the flu vaccines available end of August or beginning of September. Mm-hmm. So usually we wait till end of September, beginning of October to get the flu shots because you want it to last the whole season. This time around, we should get it as soon as they're available.
Okay. Is it safe for my daughter to play softball when the park is not requiring them to wear masks? She's only 9. This is Sulma.
Only if they can social distance through the softball game.
So what I heard, at least around here in West Lakeview, is that masks when they're huddling and when they're out, they can take them off.
Social distance.
But whenever they're together, they have to put masks on.
Absolutely.
Okay, here we go. Cynthia, we need to drop off our daughter at a boarding school. Ooh, I like how old is she? Is she a teen? Buena idea. I like this. We need to drop off our daughter at boarding school on the East Coast. Is it safe to drive or fly?
Drive.
Ay, no. Just because no me vas a dejar ver a mi mamá hasta el año que viene. Ya lo sé.
No, just a lot of airlines are not taking all the precautions. So, for example, Southwest Airlines is keeping the middle seat open. Mm-hmm. There's a lot of other airlines that are doing full flights now. So Delta's doing full air flights, American Airlines, etc. So that's where we have to be careful.
Right. She's 15. No, I know. I get you. Okay. Someone said they got Ron, should I get another test in the fall? He was tested in June and tested negative.
Is he going back to work? Probably.
Right. Like, give us a little more details, Ron. Were you sick? What's going on with you? And then people always say this. Mis papás are the first ones that say this. Someone here said, I had the pneumonia shot and still got pneumonia after that. Mi mamá y mi papá swear they get the flu every time they take the flu shot.
So remember, anytime we take a shot, people can get a little bit of the symptoms as the actual vaccine is coming through, and it's your own immune system reacting to the vaccine. So you might feel a little sick, a little fever, but it's actually your body responding and showing that it's making protection against with this vaccine. But it's not that you're actually getting flu-like symptoms or anything else like that.
Seriously, can you be my gynecologist, my general practitioner, my everything? Because every doctor Americano that I know always tells me, los nenes don't get fevers because of teething. The flu shot doesn't give you symptoms of the flu. Blah, blah. And I needed, no offense to my doctors who I love, I needed my Latina doctor to be like, yes, but it's your body reacting to what it's in there, but you don't have the full-fledged flu that can kill you.
Absolutely.
Exacto. There you go. Let's see this. Anyone who is traveling into Chicago from Florida already must quarantine for 14 days. That is mandated by the mayor. Yep, that's what we were telling her.
Absolutely.
Perfect. All right. What is our future with this thing? Are we going to wear masks forever? Is my one-woman show going to have to be virtual because there's not going to be theater for 2 years like my friend Lori worries about? Am I never going to be able to hug anyone? Can I not? I mean, this is hard for a community like ours and for extroverted people.
Absolutely. We like to hug. We like to whenever our families get together. But here's what I tell my own family and I tell everyone I know. We have to have hope, right? And science is there. Science is there, and we're working on a vaccine. And hopefully, if we are able to keep the mask going, keep the social distancing and the hand washing as a country, and we all unite, the rates of this virus are going to go down. And we're not going to have to close businesses back up. We're not going to have to close schools back down. But yet, if we act irresponsibly and don't wear the mask and, party like there's no virus around, then it makes it hard to navigate this pandemic. And I can tell you that the American Lung Association, which I worked for really closely, has actually done a $25 million donation to a COVID-19 initiative. And this COVID-19 initiative gives us a lot of hope, and you can look it up at lung.org/COVID-19, but it's towards research, it's towards advocacy, it's towards public messaging, and it's towards the prevention of future respiratory pandemics like we're living in now. And the other big message I always tell people is this has also been a nice time out for everyone. It's time with our families. It's time to breathe. It's back to board games. It's back to eating meals together, to talking. So in a sense, yes, it's been hard on the economy. This pandemic has been hard in so many ways, but I think it's brought us all together as humans a lot more.
Yeah. And thankfully because of technology, we've all connected, even with people who we hadn't spoke to in a while or hadn't seen face to face because we had that trip. I'm going to go see you. I don't need to see your face. And now we long for that kind of contact. You clearly have a lot of nieces and nephews that you can return to their parents, because if you were living with a 7-year-old that you had to homeschool, you'd be begging every stranger to wear a mask so that my baby can go back to school and be educated by somebody who knows how to do it, not by this poor mother. So yesterday I was driving down Lakeshore Drive, not tons, but a lot of people at the lakefront, even though the beaches are not opened, running unmasked, sitting in groups unmasked. Would you tell them to wear masks?
I would.
I would,
absolutely. And I would say, come on, we can do it together. Let's wear masks. Let's do it so that way we can thrive as a country. Look at places where national lockdowns are done, like China and South Korea. Their rates were really driven down a lot faster.
That's true. But they have a culture of masking too. Remember how we were all like, oh my God, the Asian tourists all wear masks. ¿Qué les pasa? Blah, blah, blah. They've been dealing with it. They've been dealing with pollution too. So they knew that it's not a big deal to wear a mask. Okay, so I want to go to other questions because people have really good questions. Here we go. Kiddo Marie, I'm nervous because I was asked to attend a training of 30 people at a restaurant. They are seating tables 6 feet apart, but participants sitting at the table are not seated 6 feet apart and won't be required to wear a mask when seated. This doesn't seem safe to be seated that close to people who are not in my household. Am I being paranoid?
You are not. You are definitely in the right state of mind, and you should voice your voice. Absolutely. Because this is what was happening at the factories and all these workplaces. They were not being social distance, assembly lines, everything else too. And this is how the rates were driven up so high.
Looking into the future, I have a niece coming to Columbia College in the fall, and my sister-in-law, Columbia College has given them a town hall meeting where they say it's going to be 1 kid per dorm, entrance and exit is one way. So they seem to be prepared. But you can't help but worry. Esmeralda's worried too about the dorm situation. What are your thoughts?
So absolutely, they need to put good actual measures in the dorm rooms and in colleges as a whole, because now, I don't know if you've been hearing, Anna, they're doing COVID-19 parties at colleges. And
in colleges, like smart people that parents are paying for their education or are putting their financial stability on the line. Estos idiotas están teniendo fiestas a ver si se les pega el COVID. Es que I have to speak in Spanish because it makes me irate.
Oh, absolutely. And we keep hearing about this, and we cannot permit stuff like this happening. And we have to educate the young people. Message them.
All right, Della, she has COPD. Wearing a mask is very hard for her. What are her options? That other people mask around her?
So one, other people can mask around, and then trying to do maybe like a soft cloth mask that's a little bit more breathable for her might be a little bit more helpful as well too. As well as some people tell me it hurts their ears a lot after a while. So then now there's extenders for masks that are soft as well too that people can use, so that way they don't feel as suffocated either.
I love Kathy Barkle was like, what COVID-19 parties? I'm going to go check my son. Ya alborotamos una mamá. Ya la alborotamos. So there was another question about surfaces. And I've heard this from friends who work at hospitals. Here we go. Are the surfaces, are there surfaces where COVID will not attach to?
So I think most surfaces COVID-19 can attach for, but one thing that we used to think as the COVID-19 was starting to begin, that it would last hours on an actual surface. Now it's more minutes. So just continue to wipe clean. I think all our homes are the cleanest they've ever been, including clinics, everything else too, because we're all wiping handles and so forth, because now we know that the biggest transmission is really like actual respiratory. Like that's why the mask is so important as well too, more than contact.
All right. Ziba Lennox, we're trying to reopen our fitness studio and there's a bit of pushback from my clients and instructors on having to wear a mask during the workout. It's really tough to wear a mask. I've taught a class outside with it. Should we do mask classes and no mask classes?
Whew. So I know gyms, we love them, right? We have fun with them, etc. But one, if they're outside, if they can social distance, then maybe they can get away, without wearing a mask. But if they're indoors, they should be wearing a mask.
No matter how small the class is and how far apart we can be in the studio.
Just because it's an enclosed environment and we're sweating. There's sweat particles popping everywhere.
Yeah, she's my dance teacher, so I know she makes us sweat a lot. So Ziba, we either wear masks when we're dancing or we take the classes outside. So Sonia, if you have any questions in Spanish, throw them at us. And I'm sure the people who are watching us in English can handle it because I want to now. So if there are any Spanish questions, go ahead and ask them. And I'll ask Dr. Mora about her background because I know a lot of my friends that are doctors who belong to the Latino community become doctors because they've seen a need through their parents. They've seen a need for bilingual medicine and a need for someone to take care of their own. Listen, I'm fluent in English and I still call my Spanish-speaking doctors when my Americanos tell me something. I go, please, digiéramelo en español. Tell me what your journey was to becoming a doctor.
So I was born and raised here in Chicago. I'm first generation Mexican American. I'm the oldest of 5 kids. My parents are from Mexico, and my dad worked as a butcher, and my mom, as a stay-at-home mom, grew up in Pilsen neighborhood. Hi, Pilsen. And nice Catholic family. We went to St. Pius, etc., church, and we really grew up humble. Both sets of grandparents were part of the Bracero program. And the Bracero program were working the lands. They would come to the U.S. and work the lands. And so I knew probably at age 6, I remember sitting at the table and telling my mom, I think I know what I want to do when I grow up. I said, I want to be a doctor. And that dream, like my parents could have been like, well, no, we don't have that type of money. We can't afford that. What my parents said is, well, you're going to have to work hard and you can conquer that dream. And I remember, working so hard in school, like, your parents, Latino parents make you feel like a B is an F. So A's had to be the norm.
They have to be comfortable A's too. They can't be A minuses. They have to be una A cómoda.
Absolutely. And so I went to Lane Tech High School. I went to college at University of Chicago. I went to UIC Med School here in Chicago as well, too. I did a double residency in internal medicine and pediatrics at Rush, followed by allergy and immunology fellowship at Rush. And so I've been Chicago-based all my entire life.
That's very lucky for you.
It really has been amazing. So that has allowed me to build a lot of bridges, especially in the community, right? Because a lot of the people I went to school to throughout high school, throughout college, throughout med school now refer to me, which is so nice as well too. And then, you know, I know the communities really well. I know Little Village, I know Pilsen, I know as far as this COVID-19 virus is hitting, like the hot areas, the Belmont Cragen, the Gage Park, the actual
Hermosa, Humboldt Park.
Absolutely. And so it allowed me to say, you know what? These are people that, as it was happening in the meat packing companies, I thought this could have been my dad. He was a butcher in a meat packing company. And it made it feel so much more real. And I said, I have to do something. And I've loved my journey in so many ways because I love being a doctor more than anything in life. Like, I really love my patients. I love, you know, coming to work. I can never say one day that I am not thankful. And my desk, you'll see, I'm big Catholic girl, Virgin of Guadalupe sitting on my desk, the cross, everything else too. And I thank God every single day that I was given this mission. And I don't take it lightly. And I love, you know, being a voice for those that have no voice, especially through a pandemic. And American Lung Association has really allowed me to do that. And interviews like yours, Nana.
Juanita, how did you afford all that education? I know that it may be an improper question, but that's what people who are going to watch this, little girls that are 6-year-olds, that, you know, it is expensive, not only for a family like yours, but any family right now.
Sure. And to all the little girls and little boys listening to this talk today, study hard, work hard. I got a full ride scholarship to University of Chicago. And I actually applied early admission when I applied to University of Chicago. And it was probably one of the best things. Med school, I had some loans and everything else too. But overall, you know, that's what has kept me going. And really, I feel that if you really want it, you're going to work really, really hard for it. And there's going to be roadblocks, like everyone has roadblocks. But if you really want it, it's at your reach. You can do this. And there's no one that can stop your dreams.
And always find a mentor. Did you have mentors?
I did. So I had teachers who guided me throughout. And that's why I have such deep respect for teachers, because they really help to guide your next steps. Like, there was a teacher who, when I was going, I graduated 8th grade in Pilsen, told my parents, you need to send her to a high school where she will reach her full potential. And so I would go on a bus all the way from Pilsen to Lane Tech. And that was a big ride, but my parents knew, well, that was the way to actually get it. And then it was another teacher who said, you would do really well at University of Chicago. And that's how I got into that college. And so it was so far, you know, you find angels along your way.
And you have been an angel for so many people. Look, Trish, my family loves Dr. Mora so much. Thanks for doing this. You can see the passion and joy in the doctor's commitment to medicine. Love her. She's my daughter's doctor. And I have to say that, look at the difference. You found teachers who told you that you belonged at the University of Chicago, that you belonged at Lane Tech. And Michelle Obama found a teacher at Whitney Young who told her she didn't belong in Princeton. And because her brother was already there and her parents supported her, she said, I'm going to show you. But not every kid has that strength. And not every kid has the power to push that away and say, no, you know what, I'm going to do it. So adults sometimes don't realize what happens when they say those things.
Absolutely. And one thing I want to recount this. At University of Chicago, I went to see my counselor and I told her that I was interested in medical school. And she told me, oh, honey, from your background, you should think of nursing school. She's like, you'll never get into medical school.
But you're at the University of Chicago. What does your background have? ¿En qué año estaba? What year were you in?
So I was there in 1992 to 96.
Oh.
And I graduated with honors from the University of Chicago, Anna, and I can tell you, my parents, because I graduated with honors, and we were so few Latinos, I have not told this story publicly ever, I think. My parents had second row because I was honors from University of Chicago, and my parents 4 times were asked to verify their tickets and taken out of their seats and then brought back.
Oh my God.
But I remember my mom saying, like, when that counselor told me, she was like, oh, mija, if you let someone tell you and knock your dreams out, then you're not half the girl that I think you are.
Toma.
And you gotta love the Latina moms for that. Absolutely.
And for putting up with, let me check your tickets. I don't know if you belong here.
Absolutely.
For the mere fact that they were Mexican, because you can't tell me that they went in cut off shorts and, you know, like no sleeves. Because that's another thing my dad taught me. We have to dress 100 times better than everybody else.
Absolutely. And you have to, be your completely. You have to, because you're representing your culture, they're like, as a doctor, you need to look the part.
You need to look the part. And I love that your curls are flowing and that you're wearing a cute dress. I appreciate all that. I see it. I am so proud of you. I'm so glad we had this conversation, but I want to go back to, if you don't mind, a couple more questions if people have.
Absolutely.
Gaddy's, hi, with schools opening this fall, what are the risks of COVID-19 along with the combination of the flu going to be like? Do you think it will cause more cases to emerge? And because that's why you want people to have the flu shot.
Absolutely. So yes, the answer is yes. So get your flu shot early and let's get this pandemic under the best control that we can.
I know. It has to be discouraging when people question the validity of this virus, huh?
It is, because I saw firsthand, that's why I think I became a journalist dream, because I was talking to all these families and they were, firsthand, and they were telling me, my first question is like, who else is affected by your family? And I remember this woman, like the first few weeks I was doing this, and I said she was at a hot dog factory. A lot of the coworkers got infected. She was hospitalized and she was getting back into it. And I said, oh, did anyone else in your house get it? And she said, my husband did. And I said, oh, how's he doing? And she said, he didn't make it. He was only 46. And now she's left to raise 4 kids on her own. Then you hear stories where, there's such fear because they lost 2 or 3 coworkers to this virus. So when I hear that this virus isn't real, I honestly, Anna, want to bring all these stories to the light and let people hear them. And really, like, I've been journaling a lot of the stories because they really touch your heart. They really do.
Yeah, it's the first thing you told me. We have to tell these stories because I think that when they're not close to you, when it's not somebody you love or or even like somebody's uncle, you don't realize that it is around the corner, and that, the essential workers are janitors, are nurses, but they're not just doctors. There are so many people in that totem pole that have to go to work. I remember posting, that the African American community and the Latino community were highly affected. And someone said they're not taking care of themselves. They are partying. And I have a problem with everyone seeing life either right or wrong. Like, life has these gray areas, right? And these communities, like many communities, are losing jobs. People have issues with daycare. Some people are trying to support a family of 5, and they don't have the luxury that I have of working from home, or my husband working from home, or getting a salary guaranteed until we can reopen. And you have, what is very sad in this whole situation is the lack of ability of some people to think about others, because hoy por ti, mañana por mí.
Absolutely. And Anna, what we know from the studies, only 16% of Latinos can telework. So if you think of the food chain, all the grocery store workers, the tortilla factory workers.
They're all considered essential.
And they're all essential. And
with the labor practices, with the labor practices like you and I were talking about, they're not going to get tested. Their fever's not going to get checked. You better show up or you're not going to get paid.
Absolutely.
Right? Do you think, Cecilia asks, that face shields are as effective as masks? Because I know some teachers want their lips to be seen and so on.
So, I mean, I think masks are effective. I think shields should be reserved for ICU doctors, ER doctors with the really hardcore COVID-19 cases.
What about the N95? Uh-huh.
So N95, I also would just consider, well, I would wear an N95 if you're high-risk asthmatic or high-risk respiratory disease, etc. Mm-hmm. Or if, obviously doctors or nurses in this high-risk work areas with, in the ICU, ERs, etc.
Also, can you tell people how to wear this? Because I've seen all over the city this.
The nose down, absolutely.
This. Señor Dios de los ejércitos. Please.
Yes, absolutely. So you want to make sure, and I'm getting a mask out of my drawer here.
Sí, porque
you want to make sure that your entire nose and your chin is completely covered. Because if you were to cough or sneeze or anything else, it's allergy season too. Mm-hmm. You don't want to make sure that your droplets are completely covered there as well too. So you want to make sure to seal your nose and bring it completely all throughout.
Okay. Is it okay to go to a banquet party of 50 people since they will have tables set at 6 feet apart? I'm nervous because it's a table of 10 people. Put a mask on.
Yeah. Yes. And if this is a family party, are all those 50 people nicely compliant, meaning like they haven't been going out, they didn't travel to Michigan or Lake Geneva over the weekend? Who do you trust?
Who do you trust? That is the other thing. Like, I've allowed my son to go play with a friend whose parents I know have been stuck in their house. It's all I don't allow groups, but now he's going to camp and they are masked only at pickup and drop off. Ya pa' qué, Juanita? Don't tell me que lo hice mal, because ya pa' qué. So yesterday, my husband's like, I don't think they're wearing masks when they're playing. I said, yeah, but I don't think they're keeping social distance when they play. Que no sabemos that this is uncharted waters, que vamos a meter la pata. But what I hear you say is err in the side of caution.
Err on the side of caution all the time. Absolutely.
Okay. Yeah. Anything else you want to add to this? ¿Y dónde estaba tu vino? Because you sold me a bottle of wine.
Okay, so this is Fantasia from Castillo de Amore from Napa Valley. Red sparkling wine, perfect for that sangria in the summer. I'll send you a bottle, Ana.
Ay, bendito. You don't have to. I'm going to switch allergists at this point. I'm going to have you have you're going to do my mammogram.
Really nice.
Oh, she's a wonderful person. I know. And, another thing, there was one more thing I wanted to ask you. My sister-in-law lives in Puerto Rico. She's coming here to drop off my niece with my brother. They're all going to get COVID-19 exams. Does everyone need one? Is this a thing that we're going to have to do? Who needs the COVID exam? Who needs the antibody? Walk me through that.
So as we're reopening the state and so forth, so for colleges, a lot of them are actually going to want both an active nasal swab and also antibody test. So that way they know people who actually have had it, or also people who have active cases as well too. So I know that in a lot of college campuses, that's what they're doing. As we're reopening, a lot of people are going back to work July, August, September into the actual workplace, and a lot of workplaces. And one of the things is I wish they would pair up with the doctor and walking through their safety guidelines. Because that would be nice to kind of partner up with someone from the medical community, because it is uncharted territory. Like the Illinois Department of Public Health gives you safety guidelines, but they're just guidelines. And it's kind of like a lot of people are feeling lost, especially the smaller businesses, as well too, as how to make it actually safe. Like, for example, we go and get our nails done, right? And now there's plexiglass right in front of them so that way, but they're still touching your hands and they're still touching your feet.
The flower shop downstairs was like, can you ask her? Do we need to take they're having people wear masks. Do we need to take temperature too?
They should take temperatures as well too.
Of the clients?
Of the clients. Just because
ustedes están alborotados.
Just because it's nice and easy. Just because not everyone is going to be responsible, right? So there's people who are going to walk in with fevers as well too. Or they might not know that they actually have a fever as well too. So it's a good way to screen people.
Perfect. I so appreciate this. I wanted to hear all your answers. I wanted to hear your amazing story, and no, you never disappoint. I wanted to catch you before you become famous.
Yeah, right now.
Exactly.
In my house, my dad's like, no. Ni qué famosa. A lavar los trastes.
Así, a mí me dicen lo mismo. They keep us grounded all the time. If people need more information about you, I've put your website right there, the ChicagoAllergyCenter.com. And can you give us a phone number just in case?
Sure, 773-614-7315. Happy to talk to you guys completely, and thank you. Thank you for the wonderful interview.
Oh my God, thank you. And stay healthy, and thank your entire family for putting their life on the line for all of us. We appreciate it, because we don't know who we come in contact with. And it could have been a patient that you sent to quarantine because you put faith before fear.
Claro que sí.
Gracias, doctora. Cuídese.
Igualmente, un abrazo.
Ciao. All right, guys, if you're watching this on YouTube, thank you so much. Leave me your comments. You can check out ChicagoAllergyCenter.com to contact Dr. Juanita. What a wonderful interview. What a great story. Inspiring and helpful. If you have any questions, listen. You will be able to ask anything, porque ella como yo. If you email us, we respond. And so I hope that this Wine Wednesday wine, answered all your questions about COVID. Apparently, the bottom line is wear your mask, social distance, be careful, get your flu shot early. And I will post this on YouTube. Thanks for watching us live. Salud. And here's to the next 2 days. Thank you, guys.